But my guests are in the studio right now, and it's lovely to welcome onto Chat City this morning Derek, Omerod and Mr. Gupta. So a very good morning to you both.
Good morning.
And lovely to see you. Thank you for coming in. And I don't know who wants to start first, but we're here to talk about this weekend, this Saturday. It's the 13th annual Health Mela here in Preston. And it might be nice, before we talk about this Saturday, if somebody can tell us about how it began and, what's happened over the years. So I'm not sure who would like to do that.
I think Professor Gupta is probably the best.
Professor Gupta, okay.
He's been involved for slightly longer than I have.
So I shall leave that task to you then, Professor Gupta. If you could tell us something about the Mela and its origins and how it's taken off here in Preston.
Well, good morning, everybody. I think the origin of Health Mela goes back to 14 years when we were engaging the communities to take charge of their own health and to make sure that everybody had the access to health. We were very much aware that in certain ethnic minorities, the evidence was that the high blood pressure, strokes, renal diseases were higher, and yet the access was poor. And we came to the conclusion that this was not because of the language barrier only, but there were unwillingness on the part of the communities to go and see the GPs, and also the lack of knowledge as to how to access the health services and lack of knowledge about the health issues itself. So to promote health and to improve that awareness, we started monthly workshops in the Gujarat Hindu Society, and after 1 year we came to rightly or wrongly to conclusion that why don't we open it to wider audience, and we started the first Health Mela in 2001 at Gujarat Hindu Society, and we continued there for 10 years till the mayor of Preston, Bobby Cartwright, was very kindly during the Guild year offered us the Guild Hall, and it is third year now in Guild Hall that we are holding this.
So this year will be the third year, and it's to be opened by Dr. Tim Ballard, who's the Vice Chair of the Royal College of General Practitioners.
Yeah. Over the years, each year we have attracted a very high sort of profile person to come and open it. It has included the Chief Nursing Officer, the Chief Dental Officer, the Director of Equality and Diversity from Department of Health, Royal College of Physicians, President of the General Medical Council, and so on and so forth. And this year, it is the Vice Chairman of the Royal College of General Practitioners, Tim Ballard. The reason is that he is from Lancashire chap who is doing a practice now in Wiltshire and is a very high-profile doctor. And we will be discussing in the breakfast meeting the role of the general practitioners, because the CCGs now are in charge as to how to spend the money in the local area on health issues.
And over the years, I would imagine that you've had more and more people who are coming along to visit the Mela, but also people who are coming along to actually put the stands up in the Mela and to be there to meet with the public when they come along.
Yeah, that's absolutely right. But first of all, I'd like to emphasise the point that Professor Gupta made a moment or two ago, that although this Mela started its origins were in the ethnic minority community, it's since then become a firm favourite with all the communities in Preston, so much so that last year we attracted over 2,000 visitors.
Wow.
And you mentioned the stalls. We had the best part of 100 stalls there, representing all sorts of the faces of the health community, age concern, diabetes concern, the Alzheimer's Society, you name it, they were there. It's really an opportunity to find out everything you needed to know, and lots of things you didn't even think you needed to know about health. A real good day out for all the family.
I have been along to it myself, I think most years now since I've been in Preston, and I agree with what you've just said. And it is a nice way of bringing the community together, but equally it is a really good way of looking at health issues and meeting health professionals on the day.
Yeah, I think the important issue is that they meet the health professionals in a very friendly and non-threatening environment. And this is the community-initiated events, really. This is the community is engaged, and they are taking charge, really, as to how to improve their own health. And they are keen to be aware of the illnesses, how to prevent them, and they can talk to several people there, professionals, directly and very confidentially. In addition, there is an open forum where they can take the advantage or opportunity to get health MOT done, where the height, weight, blood pressure, cholesterol, sugar, everything is checked in one go. And if there is anything wrong, then they will be counseled and advised as to what is the risk of having a stroke or a heart disease and how can we reduce it. So I think this is an excellent way of taking these forward, and the general practitioners are kept informed about the ailment if we find an increasing number of abnormal results are found each year.
Right. And I think another important part that maybe people don't realise is that Health Melas provide opportunities for health professionals in training to develop their skills in community-led settings.
Absolutely. Professor Gupta has just mentioned the fact that after you've had your health MOT, you get the chance to get really good professional counselling, and for that we're absolutely indebted to our student members from the University of Manchester Medical School. Senior students who are working under supervision can give you a really good background information on the results of your health check and what you need to do about it, and refer you perhaps to some of the stall holders who've got specialist information. It really is an opportunity for medical professionals in training to work in a community setting and to work with the community to develop good health and health practices, rather than being on the receiving end of medical problems as they arise in the surgery. So it's a proactive opportunity to develop good health within the community.
And sorry, go
absolutely.
on.
And this year we are bringing the nurse students from the UCLAN, our local university, who will be watching and who will be getting training, and maybe perhaps in the future who will be undertaking these tests.
And again, as you say, it's for all the family. And it's nice also that young people are coming along to the Mela, and maybe people in the future who've not thought of a career in nursing, in health. This could be an ideal opportunity that's going to actually focus those young people on their future.
I think we never thought that way, but you are absolutely right that it provides them the opportunity to see the professionals in action, if you like. They can see the nurses, they can see the physiotherapists, they can see the doctors, they can see the medical students in action, and they can then choose whether it is for me or not. I think a lot of young people are inspired, and following the Health Mela, then they come that how can we have some more experience in nursing in local hospital, or how can we have more exposure in pathology laboratory.
Yes. So it's taking place, it's this Saturday, and the venue and the times?
It starts at 11, it's in the Guildhall, and it goes on till 4 o'clock. There's plenty for everyone to do, bring the whole family.
And some of the things that we've not mentioned also on the day: advice on internet safety, accident prevention and safety at home. So it really is quite a wide spectrum of advice and information that's available for anybody who wants to come along.
Hughie, because each year we develop or pick up a sort of theme. And we have done themes on children health, we have done themes on mental health and others. This year's theme is on safety. And we think that if you work in a safe environment, and your health, it adds to value of your well-being and health. And that is why we are going on those issues which you have just highlighted. And I think this will be a fantastic opportunity to see that how safety at work relates to your well-being.
So certainly the evidence 13 years on is the evidence base is the success of the day by the people who actually visit.
That's absolutely right. And not only that, the model of the Preston Health Mela is now being widely adopted throughout the country.
I was going to ask about that. So again, it was a first year in Preston?
Preston is a forerunner, and we should, as a Prestonian, we should be proud of that this is the model which has been accepted as a blueprint by Department of Health and various senior public and NHS leaders. Lately, we are developing a partnership with the Rotary International, which is the biggest community volunteer organization involving millions of membership, that they will be spreading along with us in other parts of Cumbria, Lancashire and Greater Manchester.
Brilliant. So there you are. So it's the 13th annual Mela, and it's this Saturday, 3rd of May 2014, 11 a.m. to 4 p.m. at the Guild Hall. Is there a website or anywhere people can go to find out more?
Yes, we have a website. It's www.nfhw.org.uk.
Lovely. Well, can I thank you, Derek Omerod and Professor Gupta, for coming in this morning on to Chat City and telling us about the Mela. And I know it will be a success, and I'll be along there. Thank you very much.
Thank you very much indeed.
It's been a pleasure. Thank you.